Good afternoon, everybody. This is take 11 of my LP2 presentation on the Patient Protection and Affordable Care Act. My name is Alexis Mowry. I'm with National American University, and today I will be presenting the relationship between three branches of government and the Patient Protection and Affordable Care Act. This is also known as Obamacare, or just generally referred to as the Affordable Care Act. So, in the beginning, the post-World War II boom, the legislative, executive, and judicial powers have impacted health policy creation and exercised the role of all three branches in specific ways to impact the Patient Protection and Affordable Care Act. The popularity and affordable actions presented on paper gained a favorable following as open enrollment day approached in 2010. And even though there were a number of financial and communication issues that arose with the review and the application of the PPCA, President Obama sought to hold and apply his executive powers to change health and public policy. And this presentation strives to present the issue of all three branches of government towards health policy and the application of the PPCA. So, the executive branch, their role on health policy is to meet with the various department heads to actively discuss and share ideas on health policy and health issues. In light of the current pandemic and response to problems with the Patient Protection and Affordable Care Act, the President has met recently with the Department of Health and Human Services. This is to discuss vaccine response, low-income access to health care, payment of physicians, and emergency food relief. He has also been actively involved in seeking advice from the Department of Agriculture to get local food supplied to food banks, payment of food products to SNAP, farm subsidies, and nutrition. The role of the legislative branch in health policy is Congress and the House of Representatives and the Senate are entrusted to review policy set forth by different members, executive department heads through proposals and bills. If a policy shows great benefit for all citizens, then a proposed bill can be voted into law and signed officially by the President. If there are questions about different points on policy, a subcommittee may take a closer look by placing the proposal under review. This raises questions about who would pay and how people would pay for the new insurance offered by the Ppaca, which at first meant that Congress rejected previous versions of the bill that were delivered in 2008 and 2009. The influence of the judicial branch towards health policy is the judicial branch tests various details of the bill through review. And this is done through an investigation and formation of a grand jury. The grand jury is a group of people put together to look at each step, process, and subparagraph for various legal issues and contradictions. The members may recommend for certain sections to be rewritten, subparagraphs to be edited, or amendments added in order to avoid further legal action or proceeding details that may be challenged at a later date. So, how does each branch directly involve the Patient Protection and Affordable Care Act? At first, the executive branch was put under great duress and review because President Obama used an executive order. An executive order is actually meant to be used in great times of need or distress. The legislative branch was called into details about the PPACA on the grounds that existing care for many citizens through an employer plan or small business cooperative would be erased away, leaving people with no option and no security with health care. Also, financial concerns were also raised after the program failed in two test markets, those being the states of Vermont and Rhode Island. And the effect of the judicial branch on this review brought up security concerns based upon cybersecurity and how people were supposed to use the healthcare.gov website. In fact, the website crashed many times due to overwhelming requests and due to the overriding of people for various policies. So, the effect of impact and the government review. There were issues with implementation because many municipalities faced employment and funding shortages. They could not get enough people trained and up to date to communicate to citizens on how they needed to use healthcare.gov and what policies were available to them. The reliance on the internet and a one portal system meant that the system was actually overwhelmed with requests. And the timetable for rollout meant that businesses had to adjust their current policies to new rules. Modifications to the ACA raised questions if certain groups could keep existing policies. Would HMOs and HSAs place people into new tax brackets and therefore penalize people for either going with their HMO or contributing to their health savings account? So changes were supposed to be made by offering subsidies and deductible thresholds to businesses that already had policies and plans available for employees. So the domino effect of termination. If the American Affordability Care Act, Obamacare, is terminated, the executive branch is currently facing negative backlash from action groups, big pharmaceutical companies, and questions about why an executive order had to be issued for the law to pass. Our current administration wants to put in a new system proven to help low-income and working people called health choice, often called or referred to as one way. There's absolute resistance to this new system because the program does not come from a majority Democrat or increase prices on prescription, which then fund the role and the impact of big pharmaceutical companies in our life. Also, there's the issue of a third term. Obamacare would have actually worked with more revision, staff preparation, and financial resources. In order to do that, Barack Obama would have had to have been voted in for a third term as president in order to improve and make his legacy strong. Challenges in the House and Senate as related to the Affordable Care Act is now Americans are getting more involved in local issues. These are creating new opportunities for other candidates in political arenas, and one where citizens feel that they are offering candidates who actually have an idea of what people are going through on a daily basis and how hard it is to sustain health care. In Congress, established Congress members are receiving primary challenges and asked why that representative who has multiple terms should continue if they are not respecting what their constituents and what citizens are asking for. In return, these questions are raising a distrust of large action groups and special interest party connections. If I contribute to a certain campaign or a certain national group, what am I going to receive in return? And there are questions about how healthcare would be funded, and will local clinics and hospitals close in favor of privatizing certain health networks and paying private medical groups and investors. In many cases, we are already seeing the issues with this because prisons are now becoming privately held entities. In the judicial branch, there are rules and regulations, but there is also a question of legality. Is it right for the Patient Protection and Affordable Care Act to drive working Americans deep into medical debt? Is it right for a hospital to collect on a medical debt by taking a house or business away from a family? These issues were brought up in the case law and precedent of Florida versus the Department of Health and Human Secretary and the Department of Health and Human Services. So, another impact this will have is if there are justices who are going to leave the bench, will we be putting justices in with new conservative policies And if that is the case, how will those policies change? Will the tradition and the addition of 2 or more justices who are conservative force a repeal and swing a termination of the Affordable Care Act into action? In conclusion, the intention of the Patient Protection and Affordable Care Act meant well, but several accepted and approved lawmaking steps were subverted and broached in order to cement the act into daily life. This showed the failure of the Obama administration to recognize gaps in staffing, finances, culture, and preparation. This hindered the true potential and the birth of the PPACA. The goal of the current administration in response to this is to offer a cost-effective method of healthcare in consideration of the coronavirus, and the broken legacy of the established Democrat position means that there is still work to do in Congress. If all 3 branches can negotiate a deal and resolve to work together, then health policy may change with substantial benefits to the American people. My reference list includes the works of Antibus Jr., who wrote a wonderful article in 2014 called Healthcare Reform After the ACA. That was put in the New England Journal of Medicine and the subjournal Perspectives. Brian Dunnigan wrote a wonderful article for Encyclopedia Britannica about the opposition to the Affordable Care Act. A wonderful lady by the name of Ashley Fox and her cohort Nathan Blanchett wrote about the issues of Vermont and Rhode Island in the little state that could not. Chris C. Jennings wrote a wonderful review of the implementation and the legacy of healthcare reform. This was done in the New England Journal of Medicine and Perspectives magazine. I also had help in research from the Legislative Council, the United States of Representatives, and this was the actual 900-page act of the Patient Protection and Affordable Care Act. I followed this up with a critical analysis of Obamacare done by Leland Manchakanti, Stephen Helm, Rushid Benyamin, and Joshua Hertz, who wrote a further analysis review of Obamacare for Paying Physician and Health Policy Review. And a lot of my opposition and conclusion thoughts came from William E. Rich, who wrote Who is Barack Obama? And he has a wonderful book about the legacy of the Obama administration done by Palgrave and Macmillan with Schomburg Press in Europe. Thank you, everybody, for watching and listening. Hope everything goes well. Happy weekend.